Pfizer is up nearly 5% on that $2 billion deal from the US government, who say they'll buy an initial 100 million vaccine doses. For several weeks, if not months now, we have been talking about the way governments, US, EU, UK, they're all at it, buying hundreds of millions of doses of vaccines that haven't even been made and certainly haven't been proven to be efficacious. The Trump administration is focusing on 5 companies. First, AstraZeneca. AstraZeneca is the only one that's in phase 3 and hopes to have the first dose by October. Then you've got Pfizer. Pfizer is entering phase 3 by the end of July. The goal is 100 million doses by December. Moderna comes into the market, entering phase 3 next week. Doses we'll hopefully have by 2021. J&J still in phase 2. 1 billion doses they want to be producing by 2021 as well. And stuck well behind everybody else, stuck in preclinical, is Merck. They haven't even come up. That's the way the race is running so far. Thomas Bollyky is the director of the Global Health Programme and the Council of Foreign Relations, joins me now. Also the author of Plagues and the Paradox of Progress, joins me from Shelburne in Vermont. Does it matter who gets there first, so long as someone gets there first?
It matters geopolitically, more so than from the health consequences. There are multiple challenges here. First, obviously, we have to develop the vaccine and get through the phase 3 trials that you described before. Second, we really do need to complete the production of enough doses. Viewers should keep in mind it's likely to require at least 2 doses per person to achieve the health effect. And then, of course, we need to actually distribute it to people. So the real benefit to winning in terms of having a proven vaccine that can get licensed by a credible regulator is going to be geopolitical more than from a health perspective.
And this idea of buying multiple vaccines from different providers, as the US has done, the UK has done, the EU has done. And at first blush, my naivete, I sort of think, well, they're hedging their bets in case one wins and then the other does. Is it as simple as that?
There's some of that. The main thing to understand that's different about vaccines and drugs is vaccine manufacturing is extremely limited. For drugs, you get into these intellectual property issues. You can make it in far more countries and many more different factories. Vaccine manufacturing is a finite quantity right now. So we are not going to have enough in the early days for world distribution. Whether you're the exact first to get it, if you can lock in early supplies, that means months of access to a vaccine and the benefits from that while the rest of the world waits. So having some guarantee that will happen, obviously both is important to political leaders to demonstrate to their public, but in terms of restarting your economy, protecting your healthcare workers can have broader societal benefits.
So on this issue of the broader societal benefits, I asked one of our guests last night this question: are we fooling ourselves into believing that the vaccine is the panacea that takes us back to 2019 days? I understand its significance in terms of those who are who are immune compressed and all those sort of things. But in reality, it's not going to turn the clock back for us.
No, there's no way back through this pandemic. There's only through. And a vaccine is going to be a powerful tool, but a few reasons why it's not likely to be a panacea. First is it's far from clear that any of the early vaccines protect against infection. There is an indication that they may be effective against disease. This is important because then it would work like the flu shot. So you would be able to protect more vulnerable people from getting sick. However, it would not achieve herd immunity, driving the virus out of a country or even a community, unless you can protect against infection. So protect people from getting the virus at all. So that's the first piece. Second piece, as I mentioned before, it is going to take time to distribute. There is going to be a long time where we are still adapting to life living with this virus. And the vaccine isn't going to alter that within months, maybe not even within a year. It's going to take some time to reach the level of vaccination, even if you can convince the public to take it, where you have that happen.
A very sobering thought, but I'm grateful that you gave it to us, sir. Thank you for joining us. I appreciate your time tonight.